So we're getting mixed messages about wearing masks and whether or not they protect us from the spread of the new coronavirus. Even the smartest voices are divided on the issue. CDC has been saying the masks are not only unnecessary for the general public, but counterproductive. But there are reports it's reconsidering that recommendation and will still push that surgical and N95 masks be safe for medical personnel, and that maybe simple cloth masks wouldn't be such a bad idea for everyday use by, the general public. The U.S. Surgeon General says there is no research to show the masks help. He's against the idea. So who do you believe? Dr. Saumil Oza is a cardiologist, the chief of cardiology, as a matter of fact, at Ascension St. Vincent's here in town. And he's behind an initiative to get people everywhere to wear the masks. So why do you think this is beneficial?
So, there's a lot of reasons to wear masks. One is to protect yourself, one is to protect others. There is a lot of data from other countries, from smaller randomized studies that have shown benefits of masks, just cloth masks, if worn properly and handled properly, to stopping the spread of viral diseases like COVID-19.
Now, you told me that in places like Slovakia and Taiwan, where they wear masks regularly, they've minimized the spread of the new coronavirus.
Exactly. They've made it more of a social norm to wear these masks. That way, everybody wears the masks. And if you can get widespread acceptance, make it a normal thing, then I think that's when it really takes hold and has an effect.
Now, on the yin and yang of this, I've got two comments. Dr. Deborah Birx, who we see every night in the coronavirus task force briefing, she says that she's worried that it will give people a false sense of security. If, Kyle, we could go ahead and pop up those two comments there. And then the WHO's epidemic chief, Dr. Mike Ryan, he says there's no specific evidence to suggest that the wearing of the masks by the mass population has any particular benefit. What's your response to those two comments?
Well, I think there are conflicting studies. The masks have to be handled and worn properly. So just how people have spent, hours educating how to hand wash, how to properly hand wash in this epidemic, we do need to spend some time educating the public. I have a cloth mask right here. As you can see, there's two ear rings right here, and that's how you're supposed to take it on and off is through the ear ring and not handle the front of the mask where you can actually get infection. You can actually get virus on your hands. So if you do that and then touch your face, that can be a problem. So we have to educate people how to wear the mask. So I think, one, a lot of the studies, people didn't properly handle the mask. They weren't properly educated, and when they were, they did show benefit in many of these studies. Two, I think this is an incremental benefit. We still have to tell people to wash your hands properly. We still have to tell people to keep their social distance, stay in ventilated areas. All these things are extremely important, and if wearing a mask can incrementally benefit our community, I think there's very, very little downside to it.
And the other thing is that people are worried that you're talking about taking away PPE, personal protection equipment, from hospital folk. You're not. Actually, you're talking about, taking basic material, things like you get at Joann Fabrics, and making masks from material like that. Things like, from scarves and clothing you'd use to make dresses and stuff like that.
Correct. This is actually made of shirt material from the tailor shop. Dan the tailor actually made this for St. Vincent's. And it's critical that people don't use PPE such as this surgical mask here or this N95 mask. These are not masks that need to be worn in public. They need to be saved for our healthcare professionals. If we don't have enough in the hospitals to protect ourselves, then the doctors are going to be sick, the nurses are going to be sick, the staff is going to get sick, and we're not going to have the personnel to protect the general population. So by using these masks, you could actually hurt yourself by not allowing us to be able to treat the community appropriately.
You've got an initiative underway to try and get these masks made and get people to wear them.
Correct. I've been trying to convince hospitals, businesses to get on board with this. We need restaurants giving away masks with orders. We need these to be sold at grocery stores and other stores like Home Depot and Lowe's where people are going. We really need this to get out there and for everybody in Jacksonville to start wearing these masks. I don't think it's too late for Jacksonville. We still haven't hit the surge. So if we can right now get people to really take heed and start wearing masks, I think we can make a difference.
Are you getting some people of note involved?
Well, yeah, we're trying to get the Jacksonville Jaguars. We're talking to them, and we're trying to get some player sponsors. I think the way that other countries have done this is they've gotten celebrities to endorse wearing masks. We have a hashtag masks for Jacks, masks the number 4 Jacks. So if people wear their interesting masks, take pictures, and post them, I think that would go a long way to convincing people that this is going to be the new norm. This is a way that we'll get back to work quicker after we kind of get over the hump into the other side of this. This is how we'll be able to leave our houses and actually get things back to normal when this epidemic finally passes. So I think this is going to be a very important initiative for everybody. You know, our hospital, St. Vincent's, has finally they've gotten behind this, and hopefully we'll see some big changes coming in the future.
Got an idea for you. You know, put a Jags logo on it, Gator, Bulldog, or maybe a Knowles logo. You know, even people who hadn't thought about wearing them, maybe they will. Dr. Oza, thanks.
I really hope so. Thank you, Bruce.
We'll be right back.